Governor Mark Dayton will meet with House Speaker Kurt Daudt tomorrow morning to talk about providing relief for those hardest hit by rising health care premiums.
Tomorrow morning is also when the open enrollment period for MNsure begins. MNsure is bracing for a surge of traffic tomorrow as consumers rush to sign up for plans that have limited enrollment. And while most Minnesotans get their insurance through employers, about 5% have to buy individual policies. Of that 5%, an estimated 123,000 people do not qualify for tax breaks on their premiums. And with prices jumping as much as 67%, there is pressure on elected officials to provide some kind of help. Esme Murphy's here with more on that, and everything's magnified with that election coming, Esme.
Absolutely, Frank. That's a key point here. All sides say they want to come up with some form of relief for those hardest hit. And with all 201 members of the state legislature up for election a week from tomorrow, the pressure is enormous. They will have to act quickly, though. The deadline for enrolling for coverage that starts January 1st is December 15th.
Last week, Speaker Kurt Daudt had this to say about the governor's handling of the rate hike crisis.
And if I find out that those people aren't working 24/7 to find a solution to help these people get health insurance on January 1st, I'm going to call for Dayton's resignation myself, personally.
Today, the speaker sounded more conciliatory.
We obviously are on board with a fix, but it's not just the financial. There's also the fact that folks need to have the choice and the access.
Governor Mark Dayton's proposed fix for 2017 is that the 123,000 people who make too much money for a tax break would get 25% monthly rebates on their premiums. The money would come from the state's budget surplus. But Daudt and other Republicans questioned who would administer the rebate plan.
How does this get administered? Who checks for waste and fraud? How do we know that the right people are getting it?
Another concern, 4 of the 5 MNsure insurance providers have limited the number of people they will enroll, which means thousands are expected to sign up when enrollment opens at 6 a.m. tomorrow.
We do have some concern about whether or not MNsure will be able to handle the traffic.
Democrats say they have gotten assurances that MNsure is ready.
People are going to have to probably, understanding that this is going to be like a Black Friday, for shopping, that they're going to have a little bit of patience.
Now, another sticking point, what the governor is proposing is just a temporary fix for just 2017. Republicans, though, want Democrats to address a larger permanent fix so that we're not in the same situation next year. And that's where the big problem is, because any larger fix would also have to happen, Frank, at the congressional level.
Yeah, and there's problems nationally.
Absolutely.
The governor said our own plan's not affordable. Can we start to actually maybe question the existence of MNsure in general as an entity?
It is not clear if MNsure really can survive. Even Governor Mark Dayton today in a radio interview left open the possibility that MNsure may in fact not survive, saying, quote, "We will have to see how it performs."
Wow.
Yeah.
Big deal before the election.
Absolutely.
All right. Esme, thank you.